Hi and welcome to another episode of Well To Do. It's our 15th episode and I'm Andi Lew and I'm sitting here with Dr Jon Kanevsky from Aura Aesthetica in Beverly Hills. Very exciting because I've come all the way from Australia to work as an expert in my field in America, where I get to speak to the most up-to-date people, places, techniques, anything to do with wellness that helps you to really elevate your health and wellness to another level. And this man is a pioneer in his profession, a board-certified plastic surgeon, pioneer in minimally invasive techniques, which we're going to learn all about very soon. Aura is the sponsor of today's podcast, but I'm so excited that I've come across the other side of the world to be able to speak to somebody like you who's even published or authored 30 articles. Now, that is a lot of work on the side besides practice. What is something that makes you so unique? And welcome to the show, by the way.
Thank you. Thank you for having me. Thank you for your platform and also being so open and sharing your journey. I think it's inspiring to a lot of patients.
And so for those who don't understand what Aura is all about, it's about surgery that is actually ceremony, right? So if you don't know from my previous episodes or have been following me on social media, I've recently gone through an explant surgery where I've removed my breast implants and their surrounding scar tissue. And this type of procedure, which is called total capsulectomy, or some people call it en bloc, which is actually an oncological procedure, is so important because the surrounding scar tissue, actually they've discovered that there are new types of cancers, squamous cell carcinoma, anaplastic large cell lymphoma, to name a couple. But removing those as well is super important. And I think if you could tell me a little bit more about the ceremonial surgery, because you are such an empath.
So surgery ceremony is really it's an honoring of the process that patients go through. So I call the protocol or the procedure I've developed surgery as ceremony. And it's a way to honor the transformation of not just the body, but also the mind and spirit the patients go through. So much of the surgery journey as it relates to explant surgery is one of trauma, is one of fear and anxiety. Whether it's the reason that patients get the implants in the first place or the journey they have to go through to really process and understand what's happened to their bodies, and then the surgery to get them removed. The concept behind surgery as ceremony is to create a 3-step process that gives patients a chance to address fear, anxiety, and trauma that they've experienced earlier in life as it may relate to their implant surgery, and then be held and guided through the process. So the 3 steps are, the first step is a 1-week program with a psychotherapist. The therapist does something called ketamine-assisted psychotherapy.
So can you explain what ketamine is?
Sure. Ketamine is a medical anesthetic that's been used for decades. It's called a dissociative anesthetic. It's very good at helping people disconnect or dissociate from pain. So in that setting, they can drop in and not feel pain during a procedure.
Yeah.
The benefit of ketamine that's been noticed recently, I'd say more so in the past decade, has to do with the psychological benefit. It's being used by psychotherapists as an acute treatment for depression, anxiety, and post-traumatic stress.
And that's very different to the traditional anesthetic that one might go through when they're going under for a surgery.
Correct. So with ketamine, it allows me to create a conscious sedation, or more of a conscious procedure where patients do not go to sleep. The idea is to be awake, present, and a conscious participant in the procedure, therefore also not having to experience the trauma that happens in surgery to the same extent.
So you believe that there's actually trauma that our souls or body goes through whilst we're under anesthetic?
Absolutely. This has been studied repeatedly. Anyone who's undergone general anesthesia may recall the moment that they wake up and their consciousness comes back online as a real shock and trauma to the body. Even though you have your cognition, your body, you know why you're going to sleep, you know that you're having a surgery, and when you wake up, you have memory that you consented and you understand the process, your body has still undergone this traumatic process that it needs to rectify and understand.
And adapt.
Yeah. There's a saying in Chinese medicine, which is when you undergoing surgery is like going to a knife fight and knowing you're going to lose. And I think that's a way to just be aware of the process, and the idea behind surgery as ceremony and the using of ketamine in this awake process is to minimize trauma, minimize the experience of having all this happen to
You
your
just
body.
said the key word, the awake process.
Yeah.
I mean, when you first introduced ketamine to our listeners and viewers, didn't tell them that when you're under ketamine, you're actually awake.
Right. So that is a very important part of the process. So, and just to clarify, so it's 3 steps. The first part is an awake process where you're not undergoing surgery, you're working with a therapist in a very calm, relaxed, therapeutic environment, and it's a chance to address fear, anxiety, trauma related to the procedure or anything else going on in your life. The second step is the surgery. The surgery itself is done in an awake or conscious setting. We call it either conscious sedation or awake. And ketamine is used as the main anesthetic to help keep you in a comfortable place, but also to bring back that intention and ceremonial nature that was addressed with a therapist. I also numb the areas. That's where fat gets removed from when I do fat grafting procedures or for other types of procedures. And then the third step is body work. And that involves bringing the somatic experience back into your body with either a certified lymphatic therapist or another type of body worker to really ground and bring you back into your body and meet the new you.
Wow, the new you.
Yeah.
Because on that note, explant surgeries are on the rise. There has been some, studies, and even Google, you can see on Google it's declining with implant surgeries. You also said that there were some new stats about breast augmentation no longer being the #1 surgery.
Yeah.
And was it liposuction?
That's right. So for a number of years, breast implant surgery was the #1 plastic surgery procedure, hundreds of thousands of those procedures being done a year. And last year, for the first time ever, liposuction was actually #1 and breast implants fell in #2. And there's many different reasons that could be. I would like to hope that it has to do with the awareness and safety issues being raised around implants, so less people are doing them. But there's also a lot more safer ways to do liposuction now, and it also happened during the pandemic, so there's a lot of people with more downtime. So there's a lot of variables that can be responsible for that change in trend, but I'm just happy to see the trend is happening, that breast implant surgery is going down in popularity, and the alternative techniques are increasing.
And on this note, to bring it into context, I would like to hope that it's because women are now doing fat transfers instead of re-implanting silicone or saline. You don't implant, so you're doing fat transfers.
Correct.
So you believe that that's less invasive along with the type of ceremonial surgery that you're doing?
Absolutely. I think fat transfer is a more anatomically appropriate solution to to patients who are seeking to make any kind of transformation to the breast. The breast is mostly made of fat and gland tissue, so it's not that it needs an implant if you're trying to do a procedure. It's fat is a more appropriate sculpting medium in my perspective.
And so safer. And from my understanding, when I was going through my own explant journey, I saw several surgeons, and fat transfer was just not an option for me. I did consider it at the very beginning, but I perceived that as more trauma and also longer on the table.
Absolutely.
So
yeah.
I was just like, we can always do that like down the track.
Right.
Do you know what I mean? And luckily enough, I was just happy with the result. But for even like women who have had mastectomies, is that kind of thing possible? That's, what I'm sort of hoping.
Yeah, and it really depends on what the desired outcome is. So just to touch on the first thing that you said, I intentionally stage my procedures always. The explant happens first, and then at a later time is the fat grafting. And I do it for a number of reasons.
So it doesn't happen on the same time?
I prefer not to do it at the same time. Almost never do I do them at the same time anymore.
Yeah.
One, it's for patient safety and outcomes. It's less operative time.
Yes.
Also, I think it's important to really go through the process of letting your body heal from the
Yes.
trauma of the implants caused before trying to bring on another
And then blasting something in an empty cavity, right?
Correct. Oh, so for sure, and that has to do with the second part, which is that the outcomes are better. It's very difficult to expect fat to survive in an area that's just been traumatized by surgery. So what I like to do is let the breast heal, let the patient psychologically, physically, emotionally heal from getting the explant, and then let's talk about reconstruction and rejuvenation of the breast with the fat. The fat will survive better, and also the patients are better suited to go through that. The second thing you mentioned is, remind me again, you had asked me a question on the
But I would like to hope that for mastectomy patients.
Oh, right. Yeah, and so there's a interesting paradigm happening now for patients who have had mastectomy, whether it's for cancer or other reasons, is that some patients should, and I think there's more patient advocacy for just doing nothing, and that's absolutely okay.
Beautiful.
It's okay to just celebrate having scars and not having an implant or having to consider reconstruction.
Give us a high five
there. That's totally fine. People I think, absolutely entertain that as an option.
Please, yeah.
You know, in some situations it may make reconstruction more challenging, but it shouldn't just be that, oh, reconstruction is the only option. It's okay to just have a scar, either wear a prosthetic or nothing. And you know, patients are given these options sometimes, but I don't think there's enough support for people who say, like, listen, I just don't want to deal with the problems anymore.
Support and also a celebration,
yeah,
right? That's
yeah.
why I'm like, just high five me, because
Yeah,
let's just
yeah,
celebrate
thank you for
our
that. Yeah,
natural
yeah,
state of
totally.
you know, who we
Yeah.
are, and honour that, because explants are on the rise because there is breast implant illness that is also on the rise. So this
Absolutely.
is the reason for women coming back to their natural state
Yeah.
again, their 100% organic body that they've always wanted to be.
Mm-hmm.
And you're honouring that as a really holistic look at it, which is obviously something that resonates with me, and why we're on Well To Do, because it's
Yeah.
complete wellness. So on that note, what's the research that's coming out where you're honouring there is an acknowledgement of that breast implant being the inflammatory driver?
Mm-hmm. So there's a few theories around this, and whenever there's a new, I'd say, fringe thing that's happening in medicine that then becomes more and more common. So it starts out as a noise and then becomes a signal, and then a lot of research comes in,
Yes.
and then the academic community comes behind it. I mean, it's happened with many things. It's happened with seatbelts and car accidents, drinking and driving, smoking and lung cancer. Before
the noise is getting louder of the women. Yeah.
And it's not noise anymore. It's a clear signal. And I say noise and signal in kind of like the data, data world talk.
Yeah, yeah.
And I'm using this as kind of a preface to say, whenever the signal or the wave or the momentum becomes big enough, the research follows, and the latest research is still, it's postulating. What are the different theories? And what we know for sure is that silicone acts as an adjuvant. And an adjuvant is something that triggers the immune system to go above and beyond its normal response to cause a swarm, to cause this massive immune response.
Yeah. It's a cytokine storm.
Correct, yeah. So even though cytokine storm may not be happening in the traditional sense in the body as it relates to implants, which is what more like from a really, really strong allergic immune reaction or from a really serious bacterial infection, just that low-grade inflammatory reaction getting pushed higher and higher, which is believed to be what's happening around the capsule. So the leaking of silicone from an implant, whether it's from a rupture or bleed of the gel out of the implant, can stimulate the immune environment around the implant, and that causes more and more inflammatory response.
And the body walls it off.
Correct. It walls it off and makes that capsule.
That's right. So for those who don't understand what a capsule is, it's the scar tissue that's surrounding now this actual implant, because the body's perceiving it as an invader or a foreign object and wants to sort of protect it from going into the rest of the system. Yeah. But our scar tissue is our system, so it's all connected.
Correct. Right? That scar tissue is a living thing. That capsule is a living environment. And I always think it's funny when people say silicone is inert, the body doesn't react to it. Well, if you really want to get technical, something the body doesn't react to wouldn't create a capsule around it. So any foreign body that gets into under the skin is going to create some sort of capsule around it, whether it's the tip of a pencil if you accidentally nick yourself, or an implant. Yeah. But if you inject natural organic tissue, whether it's an organ transplant or fat or things like that, the body doesn't form a capsule around that because it recognizes itself. Yes. That's the only truly, I think, inert way to think about things. Even titanium, which is used in implants and stuff all the time.
Well, nothing's really inert when you've got living organism around it. It's wanting to help it to move.
Yeah.
I included actually where the FDA reported that silicone is not inert in my new book. So it's really important to note that the rupture that we were traditionally looking for, which is what happened in my case, where 6 surgeons and an MRI didn't pick up that I had a rupture. And only after the surgery I got woken up by my surgeon saying, indeed, you were right, there was a rupture exactly where you were pinpointing.
That's incredible.
And you know, medicine's not a perfect science, and he said, you know, it's important for us to start listening to our patients more. He said, you taught me a lot today, I'm going to go back and have a look. But now in hindsight, and I was talking about this to my diagnosing doctor, is that we were traditionally looking for a hole in the bag, which was meant to be a rupture. But a rupture can come in all shapes and sizes. It can become just this melting of the silicone itself because it's not inert. And in my case, it was a fold where it became a weak point. So that's the interesting part, why, you know, you're so passionate about what you're doing right now, is because people are getting sicker and you want to help them to get well. So on that note, may I ask, you know, what is it that drove you to be Dr. Jon Kanevsky? You know, what is it that made you want to all of a sudden get into this industry?
So I was fascinated with plastic surgery almost from the first day of medical school, both the reconstructive and the aesthetic side. My very first exposure to plastic surgery was when I was volunteering as a medical student in Guatemala, and I watched cleft lip and cleft palate surgeons working on children, and I was like,
blown away.
Blown away. You know, there's operating all over the body. There's so many. It's a combination of artistry, science, creativity, but also humanity. And now every surgery is different.
Children have the ability to be breastfed, for example. How young were you able to see these kinds of surgeries?
How old was I, or how old were the children?
Were the patients?
Yeah, anywhere from 3 to 6 months old for some of their first procedures. Yeah.
Wow.
Yeah, and then there's a big range depending on when their first surgery is, but cleft lip and cleft palate is a lifelong kind of surgical process.
So from that to aesthetics?
Yeah, so the transition there happened throughout residency, where I learned more about all the different subsets of plastic surgery. And it wasn't until I really started to learn about minimally invasive procedures, and as it relates to the breast, I started to think, wow, there's real potential here. So I moved to California to do my fellowship from Canada.
Yes, you're Canadian.
Yeah, that's right. So I lived in Canada for 15 years. I did my medical training there. I did my residency there. And then once I finished my residency in plastic surgery, I said, I want to go further in my training, and I want to get better at aesthetic surgery. So I moved to California, worked with some of the best docs here. And it was working with those surgeons that I started to really see what you had mentioned, which is listening to the patient. And I distinctly remember one day in clinic where I think it was somewhere between like 4 or 5 patients in a row had come in saying, I think my implants are making me sick. Yeah. And I distinctly remember that day leaving clinic being like, I just don't want to, until I know what the situation is, I don't want to do implant surgery anymore.
Wow. For
a few reasons. One, I don't believe that, and at that time, this was almost over 5-6 years ago, the buzz in the surgical community was that the patients are crazy, and I just hated that perspective. I really strongly was against it, because I'm like, 5 patients in a row is not just,
the sufferer is the expert.
Exactly, and so patients were coming and telling me the information. And again, not everybody who had implants was sick, but enough in a row that I was like, something's off here. And I couldn't accurately predict who would get sick from implants and who wouldn't. So I decided, until there's more information, or I better know, I'll just step away, and there's so many other things to focus on. And that's when I started to get more interested in Explant and research and learning about that community. And that has since evolved into trying to focus on fat grafting. I believe until there's a better, more reliable, safe solution than implants, this problem is going to continue forever. There's always going to be patients getting implants and always needing surgeons to remove them to do explants. And so I'm still fully in support of the explant community, but I want to help focus and develop and improve the technology around fat grafting so that nobody ever gets an implant again.
Right. So that's your vision for the future.
Absolutely.
Tell me, if we had to wave a magic wand, what does that world look like in terms of even social culture and our national narrative or international narrative around this?
First of all, I think it starts with, you are absolutely beautiful as you are, and you never need to change anything. And I mean that, even though that's the industry I work in, because I think if people approach that, the acceptance of their bodies from that state, that would just really change the dynamic. And then it goes a step further in saying it's also okay to change your body if you want to. And if you want to change your body, let's do it in the most well-respected way for your mind, body, and soul. And that's...
I can't stop crying, because I know that you mean it. And, I know walking into surgery, surgeons aren't well equipped to handle all the psychological reasons, the trauma, like why we actually implant in the first place. It's not just for aesthetics, let's face it. And so, there became this industry where, we just expected so much from one person, and then along we all went, right?
Yeah.
But now...
Do you have a tissue? I don't want you to have to right up here. Here you go.
Thank you. So, but now can you see that it's... Thank you.
Yeah, of course.
It's so crucial to have this first and foremost, this conversation first and foremost with the patient, because there are so many people that could potentially being talked out of a journey that...
And that's okay. And that's in the process of surgery ceremony, if a patient meets with their therapist and has their sessions and is like, you know what, I'm good. I actually don't want surgery, and I think I want to focus on this part of my wellness journey in a different way. Amazing. I think that aligns so well with the mission I'm seeking out for, but also for that patient's life.
That's so beautiful.
Yeah.
You know, I was wellness coaching someone just the other day, and she had been so moved by seeing me on the Today Show that she decided to remove her implants even though she didn't have symptoms.
Wow.
And I really had to, with my duty of care, I wanted to make sure that she wasn't doing it because she was influenced by me, and I wanted to make sure that it was something she really wanted to do. And she kind of came to the conclusion that, as a mother of two and all the rest of it, she didn't want to wait until she potentially had breast implant illness symptoms, potentially, to do something about it, and then, have to address all of those illnesses. So, I said to her, it sounds to me like you're being really preventative, and so all power to you, right?
Yeah.
So that's kind of like my vision for the world, even though I didn't really, know that it would go in that direction. But the more empowered and educated one is, and it's not just women, it's, the trans community as well. How beautiful would it be to let them know that they are divine in their femininity if they want, no matter, with implants or not.
Yeah.
I mean, it's all divine.
Absolutely.
So tell me, before we wrap up, what was the most profound case study you ever saw in practice?
As it relates to explant and fat grafting?
Yeah, or did something else just come to mind?
Yeah, it's kind of this arc, and it was really what was the culmination of surgery as ceremony for me, and just this affirmation that I was on the right path. I had a patient who had undergone not implants with me, but she'd undergone the explant process and was really suffering in terms of her accepting where her body was at, and she was caught between this place of should I ever move them, and also the explant procedure itself was just so difficult, and now I'm not happy with the outcome. And she also really suffered from depression. She just lost her partner not too long ago.
It's so multifactorial.
Life is so multifactorial, and every patient has got so much going on. You've got bills to pay, and kids, and relationships, and work, and
that's
all
a
that's
whole
happening.
Nother story.
Yeah.
A lot of women with BII can't even afford the surgery. That's a whole nother story.
Absolutely.
Yeah.
Absolutely.
Maybe for part two.
Yeah, part two. So this patient in particular, watching her go through the surgery ceremony process and witnessing the unfolding and love and acceptance of her body literally on the table while she was awake. I remember shortly after I gave her the first dose of the ketamine, we had dropped in before the surgery about her intention and why she was doing it, and what she was, what her vision was, and she just melted and finally said, "I just finally feel love for my body for the first time."
Wow. And this was on the operating table?
This was on the operating table before we'd even started the procedure, and it was so powerful to me. But what was even more powerful, it was lasting. So she called me, first of all, she recovered a lot. What I've been noticing is in that setting, patients recover a lot faster when they're mentally in a better place after their procedure. She didn't need as much pain medication, but then for weeks afterwards, she was telling me, she's like, I just feel so much lighter. I'm in such a better place, and I haven't felt this way for a long time. And that to me was just such an affirmation of just to keep doing the work, keep channeling in that direction, because the explant process is hard. And whether you're a patient that's seeking to do an augmentation just with fat, or you've explanted and want to find a journey to reclaim your body, that awareness that there's more to it than just the body. We are more than just this vessel. There is the mind and the spirit, and honoring that process. And that was one of the most powerful experiences for me, was to really witness that. I mean, I could tell you patient stories all day, but this is a recent one that really touched me, to say it was a positive signal from the universe that keep doing what you're doing, but it was also just powerful to see how the right setup with the right team can really create lasting change for somebody.
And I hope they're watching or listening and knowing how much it meant to you as well. And what I'm witnessing here in this new way of practice that hopefully will transcend into the rest of your peer group and colleagues is that this is energy work, really. So what is exciting for me as somebody who's come all the way from Australia to live and set up here in this environment as a TV host and podcast host and wellness expert is that I'm witnessing where the world is headed in the City of Angels, where people come from Canada, from all over, to come here and make a difference and to really infiltrate the rest. And that energy work is so important because we realize we're connected, which is the title of one of my other books, but mostly it's that paradigm shift now where we're looking at things holistically and not just mechanistically as the allopathic model once did.
Yeah.
So finally, it's a very holistic approach, and yeah, everything counts. It's all connected. So yeah, all power to you. Thank you so much for letting me interview you. You know, I slid into his DMs and I harassed him and his team to have me interview.
It wasn't harassment, super happy to talk. Yeah, but I really appreciate it. Yeah.
Yeah, and he didn't ghost me.
Yeah.
And here we are today, and hopefully inspired so many listeners. If you loved this episode of Well To Do, please do pay it forward, pass it on, or leave some comments, share, you know, send us a DM. Where can we find you on Instagram?
So you can find me at my personal or professional Instagram handle, which is at Dr Jon K. That's DRJON.K. And also the practice Instagram, which is Aura Aesthetica. If you look us up on Instagram, you'll find us there.
Awesome. Thank you so much. Well To Do, episode 15.